common disease that we would see in the outpatient clinic would be chronic kidney disease, and there are varying different ranges of elements of chronic kidney disease. Now, the most common cause of chronic kidney disease would be diabetes and hypertension. And so, especially here in America, we have very high rates of diabetes and hypertension because of the way we live on a day-to-day basis and in the lifestyle of common Americans. And so kidney disease from diabetes and hypertension is the most common disease that we would see. There's some deterioration of kidneys with age as well, and so kidney function isn't normal as people get older, and so age alone will play a role in decreasing kidney function. Less commonly, we do see other diseases, more autoimmune or rheumatological diseases, diseases like glomerulonephritis, and I know we're going to talk about this in a little bit more depth later on, but these diseases would be diseases like lupus and things like that, and more rare, more unusual autoimmune conditions where there's active inflammation in the kidney itself. IgA nephropathy would be another example of these types of diseases. People who may sustain acute kidney failure in the hospital setting, again, if people would have septic shock, or they would have angiographic dye or a medication that would damage the kidneys, we may see them for acute renal failure in that setting as well, and actively manage them during the acute phase. And once they continue to recover, continue to follow them so they don't sustain any further damage to their kidney thereafter. Also actively involved in the management of hypertension in the kidney as well. The reason for this is the kidneys are actively involved in the role of blood pressure by the release of certain hormones from the kidney tissue. And so a lot of the medications that we use for hypertension act on different parts of the kidney, and so we will frequently be involved in the management of hypertension actively. Other diseases that we may help to manage would be patients who have high potassiums or high calciums, a low sodium, for example, and that can be because of a whole host of potential causes. And so we'd, like I say, help with those types of diseases too.